Welcome everyone to the first session of MSc 1125H, AI in Global Health Research. Today we're going to be introducing what this course is about, the course outline and course objectives, and then dive into the foundational concepts of global health research, and finally end with an introduction of implementation research and what implementation research is. Let's get started. As a quick introduction, this course is really about bringing together two big ideas: implementation research, which is all about studying how to put health interventions into practice effectively, and artificial intelligence, which is increasingly shaping the way health systems operate around the world. We'll start with the fundamentals of global health and implementation research, so don't worry if you're new to the field, we'll build a solid foundation first. From there, we'll move into more advanced topics, like how new technologies are changing the landscape, and we'll take a close look at critical issues around ethics and equity, because even the most exciting innovation has to be implemented fairly and responsibly. The structure of the course is a mix of theory, real-world case studies, and hands-on skill building. By the end, the goal is that you'll feel equipped to design, conduct, and evaluate implementation research projects that are not only rigorous, but also sensitive to context, ethically sound, and make thoughtful use of emerging technologies like AI. So in short, this course is about giving you the tools to navigate that intersection between health, technology, and society, and to prepare you to contribute meaningfully to global health research. But before we get started, let us introduce ourselves. This course was created under the supervision of Dr. Pascal Tirel and Dr. Jean Carlo Segura Aparicio. Dr. Tirel is an associate professor at the Termody Faculty of Medicine and within the Faculty of Arts and Sciences at the University of Toronto. Dr. Jean Carlo is a professor at the State Distance University of Costa Rica and an associate professor at the Termody Faculty of Medicine. This course is also supported and co-created by Stefan Aguiar and Yen-Ching Li, senior fourth-year students in their respective programs. Stefan will be the TA for the course and will be your contact for all of the assignments, coursework and reflections. If you're not aware, this course is part of the Global Classrooms program. What this means is that we have students joining us not just from here, but also from the University of Costa Rica and the University of the Americas. This creates a unique, collaborative learning environment that brings together diverse experiences and ideas. We really encourage you to connect and mingle with students from the other universities. By sharing insights and working together, you'll gain diverse perspectives on global health challenges, which is essential in understanding the complexities of global health. This is also a great opportunity for cross-cultural learning. You'll be able to exchange ideas with peers from different regions and cultural contexts, broadening your understanding of how health issues and solutions can vary across the world. Beyond the classroom, these connections can also help you build a global network that could benefit your future career in global health research or practice. To break down the course objectives, the goal of this course will be to explore global health research through implementation research, as well as the role of AI in transforming how we tackle real-world health challenges. By the end of this, you'll not only have a solid understanding of these concepts but also have the tools to create your own research proposal. In Week 1, we'll set the stage by talking about global health research and getting introduced to IR. Global health research is all about understanding and improving health outcomes for diverse populations around the world. For example, why do maternal mortality rates differ between countries? Or why do diseases like tuberculosis persist even when treatments exist? This is where IR comes into play. Implementation research asks, how can we take the solutions we know work and actually make them effective in real-world settings? It's not just about having a great idea, it's about adapting those ideas to work in communities where resources, culture, and context vary. In Week 2, we'll explore the key principles of IR. Here, we'll get into the nuts and bolts of how to design and evaluate interventions that can scale. Think about the logistical challenges of rolling out a vaccination campaign in remote regions or ensuring that health workers in rural clinics have the training and tools they need. IR focuses on bridging the gap between research and practice. Moving to Week 3, we'll focus on disparities and determinants of health. Why do health outcomes differ so widely between different populations or even within the same community? This week is about digging into the root causes, economic factors, education, infrastructure, access to healthcare, and so on. Understanding these disparities is crucial because effective IR must address the underlying reasons for these differences to truly make an impact. Week 4 is where things get really exciting: technology, innovation, and AI. We'll talk about how AI is changing the game in global health research and IR. AI can help predict disease outbreaks, analyze huge datasets to identify health trends, and even support decision-making in resource-limited settings. But we won't just focus on the flashy side of AI, we'll also talk about its limitations and the ethical questions it raises. In Week 5, we'll bring it all together as we learn how to develop, conduct, and evaluate IR projects. This is your chance to start thinking about your final research proposal. You'll learn how to frame a problem, design an intervention, and measure its impact. It's hands-on and practical, and by the end of this week, you'll have a strong foundation for your project. Finally, Week 6 will wrap up with ethics and equity in global health research. It's essential that we ensure the solutions we create are ethical and equitable. We'll discuss questions like: are we respecting the communities we work with? Are we addressing inequities or unintentionally reinforcing them? This week is about understanding our responsibility as researchers to make a positive, inclusive, and lasting impact. We hope that you walk away with a lot of knowledge from this course. Some key points that will come into focus as you progress through the course are how global health research addresses disparities and needs context-specific solutions. How implementation research, IR, focuses on how to apply proven interventions in real-world settings. And lastly, how AI can enhance IR by improving data analysis, prediction, and decision-making. Global health research is research that addresses health disparities across global populations using interdisciplinary methods. So some of the key themes it involves is that it firstly looks at the social, economic, and environmental determinants of health. This could include differences in access to healthcare, disease burden between different populations, socioeconomic factors, environmental conditions, healthcare infrastructure, and more. It investigates how health systems function, the challenges they face, and how they can be improved to deliver better care. Also, it involves collaboration between different stakeholders. This often involves partnerships between governments, international organizations, NGOs, and academic institutions across different countries. For example, governments might collaborate to health policies, such as to address infectious diseases through joint vaccination campaigns. Global health researchers might also collaborate with NGOs to provide resources and expertise in underserved regions. For example, NGOs like Médecins Sans Frontieres, Doctors Without Borders, collaborate with local governments to provide emergency healthcare in conflict zones, such as during the Ebola outbreak in West Africa. These partnerships are crucial in global health research because they allow for the sharing of data, resources, and expertise, which are needed to help develop evidence-based policies and evaluate interventions. It also takes an interdisciplinary approach. It involves various fields like medicine, economics, sociology, policy, technology, and ethics to understand and address health issues. For example, researchers might use economic principles to understand healthcare financing, the economic impact of diseases, and to evaluate the cost-effectiveness of health interventions. They might also integrate sociology, when they explore the social determinants of health, which include things like cultural influences and customs. In this course, we're also going to be looking at how technology and AI can be integrated into global health research, so technology is definitely involved as well. One real-life example is some of the work Dr. Tyrell and Dr. Jean Carlo have done in Costa Rica with the Ngebe people. The Ngebe community live within the territories of present-day Panama and Costa Rica in Central America. Having strong ancestral and cultural ties to the land, the Ngebe have a profound reverence for nature and intricate knowledge of local flora and fauna. Working with the community over the years, Dr. Jean Carlo and Dr. Tiro built an amazing fruitful relationship with the community and partnered with them to create an app. Ultimately, the proposed mobile app aims to empower the Ngabe community addressing public health challenges while understanding geographic, cultural, and socio-economic factors. They use generative AI to create a translator that complements the app's dictionary for the Ngabe language. Using input from the community, they addressed challenges of limited documentation by generating translations based on context and usage by community members. As they continue to monitor the implementation of the project, they will facilitate documentation of cultural practices, aim to deliver public health initiatives that respect Ngabe culture, gain insights into health needs, the willingness to adopt and barriers to inform future initiatives. We encourage you to take 5 minutes and reflect on this question. How do you think AI can be used to improve healthcare delivery in low-resource settings, and do you think might be potential risks or challenges of implementing AI-based solutions in these contexts? Please pause the video to reflect at this time. In this slide, we highlight both the transformative potential and the ethical complexity of AI in global health. On the applications side, AI is already helping us to predict health outcomes and diagnose diseases with greater speed and precision, especially in areas lacking specialists. To optimize the use of limited resources, from staffing to vaccine distribution, through real-time decision support systems. To monitor health systems by analyzing large-scale data for outbreaks, supply chain issues, or care delivery bottlenecks. But alongside these benefits, there are serious challenges we must address, such as ethical concerns like privacy, transparency, and consent, especially in communities unfamiliar with how AI systems work. Bias in AI models, often due to underrepresentation in training datasets, which can lead to inequitable outcomes. And finally, the resource gap in low-income settings, which may limit access to the data, infrastructure, and talent needed to fully realize AI's promise. So as we push forward with innovation, we also need strong governance and local partnership to ensure these tools work for everyone, not just a privileged few. Now, we're going to move on to implementation research. So, where does implementation research fit in? Implementation research is a critical tool within global health research. While GHR identifies health challenges and proposes solutions, IR ensures these solutions are implemented effectively in real-world settings. For example, IR addresses why proven interventions might fail due to cultural, socio-economic, or systemic barriers. So, while GHR defines the what and IR focuses on the how. The ultimate goal of IR is, of course, to improve healthcare delivery and outcomes. But what's key in IR is that it has a very demand-driven nature. It's distinct from traditional research because it focuses on application and problem-solving in real-world contexts. Research questions in IR are usually developed with the relevant stakeholders, so it is very directly applicable to a specific context, where it addresses a specific problem. Implementation research generally follows a 6-step process. Contextualizing challenges. Developing a proposal. Planning the project. Conducting research. Analyzing data. Disseminating research findings. We will discuss these a lot more in classroom settings and in later lectures. Just to give a brief overview of what contextual factors IR looks at, it looks at a range of different key determinants of health, such as physical and demographic factors, socio-economic factors, for example, income and education, the health system, for example, how well equipped it is and what technology they have available, and cultural and political factors, for example, cultural beliefs, and what policies are in place. Next time, we'll be looking at more examples of IR.